So I went into medicine because when I was young, my father was diagnosed with lymphoma. I was 6 years old and I didn't really know much about, what was going on. He explained it to me as a Star Wars in the body, and that got me really interested in the body, and that sent me into towards an interest in sciences, and then ultimately into medicine, because I was really interested in how the body worked. He described it as good cells fighting bad cells, and that was really interesting to me. And learning more about the physiology of the body as I got older really put me on towards the path of medicine and then surgery, as I could fix it all and change it with my hands. Surgical oncology, it's a very multidisciplinary team approach to patient care. Patients come in with a number of cancers, and they require surgeons, medical oncologists, radiation oncologists, GI doctors, interventional radiologists, nurses, physical therapists, dietitians, and I'm sure I'm missing more, but it requires everybody to provide a collaborative approach to patient care from everybody's specialty. That really drew me into oncology care. The surgical part of that is very intellectually and technically challenging. I think you not only think about, okay, can I do the operation, but should I do the operation? How should I do the operation? And how is that going to affect the patient long term? Primarily, I think delivering good news is a very powerful thing to be able to do, especially as a cancer surgeon. However, what I realized is really building relationships with my patients has been the most rewarding. For me, I want to be the patient's advocate. I think when the patient comes to me, I need to understand what their goals and expectations are. From then, we can move forward and be able to provide care that aligns with what they want to do moving forward. If I was not a surgeon, what would I be? So this is kind of interesting, but my mother is a realtor. She works a lot with low-income families, trying to help them find their first home. So I think I would be a realtor just so I can work with my mother. So one thing that surprises people about me is that I'm a wedding officiant, and I've officiated 4 weddings for really close friends. Over the past 8 years, I've done 4 of them. So what do I like to do when I'm not working? So at home, I have a beautiful wife whose name is Athena, and a brand new golden retriever whose name is Mr. Bear. So we really enjoy walking. Mr. Bear loves the snow, so we've been enjoying that over the past few months. And then, my wife and I really enjoy food. We're big foodies, so we enjoy trying food around town. And finally, we love to travel, and that's one of the biggest things we like to do on our time off together.